everyone. A very good evening on a warm come on a chilly Wednesday in the month of April on Word Palate's Chai Chat and Community. I'm Chris Malika Bhadra, and tonight or today, depending on whichever part of the world you're watching us from, I'm joined by Dr. Raj Khillan, and we'll be talking about autism. But before I kind of get into the depth of the conversation or why are we doing this, I would like to begin the show by acknowledging the traditional owners of the land on which we are meeting tonight, the people of the Kulin Nation. And I would also like to pay my respect to the elders, past, present, and emerging. So, why autism? April is Autism Awareness Month. So, it is estimated that at least 1 in 100 people in Australia have autism. Back in 2018, 2,500, 205,200, sorry, 205 grand people were diagnosed with autism. That was an increase of 25.1%. And it was stated that males were more likely to have autism than women. And on that note, I'm very, very pleased to be talking to Raj tonight. Dr. Raj, very warm welcome. How are you doing?
I'm very well, thank you, Chris, and thank you for giving me this opportunity again. We've done in the past many shows with Salah, and this will be another chance for me to connect with public and create some awareness about autism.
Absolutely. Raj, let's get into the thick and thin of it. The first thing that I would like to ask you is, among our society or community, why is there a hesitancy among us to talk about autism in our children? And what are some of the common myths or misconceptions around this problem?
I'm glad you mix these two questions together because the answers of both are very overlapping. And particularly when we talk about our Indian subcontinent or South Asian communities or multicultural communities, the autism, I look at the journey, my own journey, when I started practicing in Werribee around 10, 13 years ago. So the diagnosis of autism was looked at as if it is you it's like a bombshell. It's a something which the diagnosis which our community never heard back in India or in our subcontinent because of the various reasons. As the autism was poorly understood, the medical fraternity at that stage was also not very clever and knowledgeable about autism, and there was not many tools and centers to pick up the diagnosis of autism. And that's how, when we as a medical fraternity was not very clever in diagnosing how this information can be passed on to the general public and how the children can be diagnosed. So that is one of the more common reason of, I believe, the hesitancy of the diagnosis, because of the lack of knowledge and lack of awareness about the problem itself. Like, as many people come to my clinic and they say, "Oh, doctor, this is a problem of the Western world, but we are from India. Why my child has this problem?" So I have to say, it is not the problem of the Western world. It is the problem of every human being living on this earth, any corner of the world. The incidence of this problem is everywhere is the same. The problem is not in the disease itself. The problem is more how we pick up the problem. And we are not, some area we are very smart in picking up these issues, and some area we are still getting smarter to pick up this disease.
Yeah.
So that is the biggest problem of hesitancy.
Hmm.
Second, I believe, is our very much cultural traditional beliefs
Mm-hmm.
of uh, that if the some mental health diagnosis being made, I believe the autism is one of the psychiatric or mental health or developmental disease, then it is going to be a social stigma and social taboo for my child, for my whole family, and I'm going to be, or my family going to be discriminated, going to be isolated socially. None of the society is going to invite us for a party or dinner or concert or birthday. So that fear factor is there, that we are going to be victimized by our society,
Hmm.
and that is a very important reason, which we need to break down the things. And this is the important reason of why there is a lot of denial in our community. And third thing which comes in my mind, particularly from our subcontinent point of view, the religious and spirituality linked with the various mental health issues and diagnoses. We still live in the era, even in Australia, that the mental health issues, the autism, can be caused by evil spirits. And instead of going to the medical professional, the specialist, they go to the religious leader to take that evil spirit away, the black magic, right, type of things. So these are the very few of the reasons why there is a lot of hesitancy about the diagnosis behind this, and many parents go into the stage of denial.
Right.
But at the other end, various parents go into the guilt stage too. They believe, as you asked me the question, various myths they're
Yeah.
linked with the diagnosis. First myth I would say is some parent go into the guilt and they believe this autism my child has because I'm a bad parent. So this is autism is not because of bad parenting. It is not because of you. So I don't think you need to put a blame on yourself and going to get that guilt, because that is going to delay the diagnosis, that is going to delay the therapy interventions for the child, and it is going to be more detrimental for the future of the child.
Right.
So please get out of this trap. It is not because of the bad parenting. But yes, because of your guilt and denial stage, you definitely will delay the diagnosis and delay the treatment, and that is going to cause more harm to your child. Some
Absolutely.
people believe this autism is caused by vaccinations or immunization. So there was a study came few years ago, not few years. In fact, it is more than 3 decades ago in UK, which was later on, proved to be a false study that it was called autism can be linked with MMR vaccinations, and that's caused a lot of hesitancy, and it is still some people are going through, and anti-vaxxers are promoting and in the market that yes, it is caused by uh, vaccination, so you should not vaccinate your child. So they're taking it as an agenda.
Yeah.
And after that research, there are various, many multicentric randomized controlled trial all over the world has done, and which has proven that it is not because of any vaccinations. So children can be vaccinated safely, and it has got no link. Other myths which many parents believe that because it may be because my child does not eat well, is having a lot of nutrition deficiencies, a lot of vitamin deficiency, mineral deficiencies, a lot of underlying allergies, carbohydrate, sugar is taking a lot of sugar. All these problems are happening because of these nutritional component. And then some of these things can be sort of a further strengthened by many people working in, even in Australia, people from the alternative medicine, nutritionists, and that say, oh, your child is because of having so many nutritional issues, so you need to eliminate these diets, these food, carbohydrate, gluten, lactose, fructose, and cut the sugar and so many things in a diet, and then you have to add so many things, and they come with a bottle of so many nutritional supplements being given, and which I believe has no scientific basis to prove that it is because of any nutritional deficiency. So it is absolutely market strategies to sell a lot of nutritional product, and I sincerely advise all the parents to think twice before putting your child on restricted diet, because most of the children with autism anyway, they are very choosy and very restricted with their diet. Their choices are very limited, and putting more restriction on that, we are likely to cause more nutritional deficiency and likely
Yeah.
to cause more trouble
Yeah.
for the child. Thank you.
But Raj, this was like you spoke very well about why are we hesitant and what are the misconceptions around it. But if I were to ask you to explain autism in a very layman term, For example, if I'm a parent and I don't know anything about this, how would you explain autism in the most simplest of your words?
All right. Look, when the child develops, there's a different aspect of child's development. When the baby starts sitting, then crawling, then walking, then with talking, in form of making babbling sounds, looking at you, smiling, giggling,
Yeah.
and playing a peekaboo. That is the stage of different stages of development of the child. So this is what we call as a fine development of the child. Child can hold food in a hand and put it to the mouth, holding the spoon, and around 1.5 years to start putting spoon in the mouth. So these are the different aspects of the development. So like a fine development, the gross motor development, the play skill development, and the social developments, and then the speech language development, and which also we talk about verbal and non-verbal speech, like when you talking to or expressing your emotions by your body language. Your body language, I believe, can speak more than the words itself. How you express your eyes,
Yeah.
your eye
Yeah.
contact, your facial expression, your body hand gestures, your body language. Each meaning can have words can have a different meaning by the body language used. So, when the child is not meeting these developmental milestones as per the age of the needed age of the child, then always need to think about this child can have or may have autism. Particularly, I would be worried about two important aspects of the child development. One is the social and play skills, and second thing is the verbal and non-verbal communication. If the child is not talking, by suppose an 18 months old child has not been saying mummy and daddy, 18 months old not pointing out to where is your mummy, not pointing out to mummy, where is your daddy, not pointing out to daddy, where is your nose, where is your eyes, where is your ear, where is your mouth, not pointing out to these things, that means child is particularly delayed in the speech, both receiving the information and expressing the information. And if the child is not having any social connections and network with any other child, not interested in playing a peekaboo, you are looking at the child and child smiling on child, and then you're not getting that smile back. You're asking the child to clap and child is not clapping. You're asking the child to say bye bye and child look at somewhere else and does not respond to you. You look at the child, the play is not interested into play, the toys they are meant for, but they are interested in playing their own different way. Pulling out the utensils from the kitchen cupboards and then playing with the utensils in a different way, putting up and down, pouring water from one glass to another water, taking a car and putting car upside down and flicking the wheel and watching the wheel again and again, looking at the fan on the ceiling and keep watching the fan, hours. So that is called as a repetitive stereotypic pattern of behavior, doing
Yeah.
one thing again and again and again and again. And despite the fact you're trying to stop that to happen, and child is doing it again. So not learning from no. So these are for a layman, I would say these are the two important feature uh, to understand. That means your child can or may have autism. So you should start the ball rolling to see your pediatrician, because everywhere nowadays what's happening after post COVID, there's a long waiting. So even if you start the ball rolling now, it may take 3 4 months before you could see the medical professional. So more early movement will likely to improve your child much faster.
Raj, that was a very clear, lucid explanation. Thank you for that. But again, consider myself as a parent and I'm not aware of any of these scientific jargon. If my child has Down syndrome, versus hypothetically, if the child has Down syndrome or if the child is autistic, how would a parent distinguish between the two? What are like some of the basic differences between these two?
The basic Down syndrome, look, if it is totally a different thing. The Down syndrome children generally they have a very different, distinctive facial feature.
Yeah.
They
Yeah.
look different than any other
Yeah.
child.
Hmm.
Children with autism will have a normal, generally normal looking feature according to the family genetics trend. So they will look more similar to their parents, one of the parent, or maybe extended family. So they will have a normal feature, nothing abnormal they have. But the delay is in their speech, their play skills, and the social skills. In a small little words, if you want, that way you can define autism.
Absolutely. Raj, the next question that I wanted to ask is, so is a child born with autism or do they develop it in their developing phases, as you mentioned earlier?
I think it's very interesting question, and to be honest, it's very difficult to answer because we still don't know the full etiology, the underlying reason why autism happened. But what so far we know that there are multifactorial, there are multiple factors
Yeah.
involved in development of the autism, but whatever the factors they are, genetics plays an important role.
Hmm.
So if the genetic is playing role, then you can say the child is prone to have that problems or autism since birth. But because the social skill, the development of the child is not to that stage where we can pick up these things in very early stage.
Right.
So maybe child may have autistic genes since birth, but we not at this stage that much smart or tuned or that much advanced to pick autism in an early stage.
Right.
So
But
generally, the earlier stage of autism, what we I have picked up around 12, 13 months of age, which is a very early stage. And that is the child who you I have seen since birth and falling up for development for some other reason. And when I saw a child who was initially playing a peekaboo at 9 months of age, now at 12 months has lost. 12 months child, calling the child by a name, now not responding to your name, not turning the head and look at you.
yeah.
Child who was initially clapping and now he lost clapping. And these are the early signs which may be really worrying for me.
Right. Raj, do you think that because now we are living in a day and time where we are surrounded by social media and technology, right? Every child has an iPad, the parents have an iPad. Do you think one of the underlying causes probably could also be overexposure to rays and technologies that this could also be a reason that the child has this?
Actually, I think I should have, covered these questions in myths associated with the
Yeah.
autism. So now, people think in that way that it may be because my child is addicted to um, social media or addicted to internet, which we call nowadays as internet dependent syndrome, which is a well-known entity nowadays. But so far, the research shows the watching too much of TV or internet or watching, being more is like a phone rather than phone or iPad rather than the TV itself. That does not cause autism, but one important thing to understand here, though it does not cause autism, but it delays in identification of your autism. It can make the already existing autism worse.
Okay.
And because the two important thing to understand here, the more addictions to the digital media, the digital world, means these children can have a hyper focus to few things. So particularly hyper focus to the moving thing. So if they are watching some TV cartoons or watching YouTube, they will be glued to that. And sometimes as a parent, particularly from a subcontinent world, we because we are generally single, like a nuclear family, we don't have extended family support. and we do have to do our household work too, the cooking, laundry, cleaning, everything. And if the small child has no one else to look after in after hours, you give the internet phone to the child. Okay, you sit down and watch. Let me finish my homework
Yep.
and our day-to-day, chores. And that's how the thing starts, and the child get addicted to the watching. And now the child get addicted to watching, and as a parent we think that, oh, my child is so good giving me a time, 2 hours he's sitting there and watching, and he's not saying anything, and I finish my whole work now. But that means you have not given that child to time to socialize with other. So
Yep.
that means child's features of autism get masked because of his addiction.
Yep. Yep.
But once you take that addiction away, once you take the phone away, now this child you will see in a much more severe range, which would have been otherwise without the phone would have been much less.
Right.
Because now you have a withdrawal symptoms. Child get addicted to see the same phone, same cartoon, same nursery rhyme again and again and again and again, or same YouTube things, and now it's not there. So that is definitely internet is causing harm in various way, but
Yep.
it does not cause internet.
Okay.
It does not cause autism itself.
Fair enough. And Raj, you have highlighted this before, but if you could just elaborate it for all our listeners and viewers, like what are the general causes and symptoms of autism?
Look, general causes, as I said, it's we don't know how it happens and what exactly happens. But the important factor which has come in the research is the genetic factor. So there are various genes we now have identified which are linked to autism, and more we are identifying, but it is not the one gene, unfortunately. Like in a Down syndrome, you named, it's a one
Yep.
chromosome defect and
Yep.
21, and then you say,
Yep.
yep, it's the Down syndrome. It's a trisomy, three chromosome X. It's a Down syndrome. But here there is a not one genetic defect. It's a multiple genetic defect is there. So identification it is difficult to say.
Right.
There are various multiple factors, other factors involved, like the babies, those who are born premature, they're more likely to have that, as you said, having a social addiction to internet is another thing. Baby born to mother with a drug use during the pregnancy, alcohol use during the pregnancy, they are more likely to have. They children those who are living in a poor socio-economic conditions, there's a lot of environmental factor that makes the underlying mild autism worse appearing because of the environmental factor. This is how the child learns. If it's a tantrum is the way, the anger is the way of expression of emotions in the family, the child will learn in the same way, particularly when he's non-verbal.
Right.
So that is the multifactorial underlying reasons. The
Mm.
identification symptoms, as I mentioned earlier, if the child is not talking, like suppose if the 18 months old child is not having a single word vocabulary to express himself, I would be very, very worried. If the
Right.
18 months old child is not pointing out to parents body part picture book, you ask put the picture book in front, where is elephant? And a child can't point out to elephant, I would be worried. 18 months old child does not enjoy peekaboo, I would be very concerned.
Right.
Then a 15, 18 months old child, you call the name and he doesn't look back, I would be very worried.
Absolutely.
A child who is having a very unusual, weird playing skills, I would be very, very worried at that age. Child who's having an unusual temper tantrum, which is difficult to manage, hitting himself, throwing the stuff, headbutting himself, and that is definitely is worrying for me. Child who is having a very restricted eating habit, who is having eating only, suppose only eating rice every day or white color food every day for last 1 year, that would be a very worry for me. Not having choices to can you can't add any new choices, that would be a very very concerning for me. So these are the few things. A child who is getting too much anxious and nervous whenever the loud sounds comes and blocking the ears with the loud sounds, like particularly in
Yep.
our
Yep.
family, the pressure cooker, use of blender, hair dryer, hand dryers, type of things.
Yeah. Uh, but Raj, in the general demography of things, are males more susceptible than females? What has your observation been?
Absolutely, there is a no doubt. I mean, in general, 10 years ago, the incidence was 1 in 150. And nowadays, the incidence overall, it has become 1 in 70. So 1 in 70 children, they have autism spectrum disorder. And it is definitely much more common in boys as compared to girls. We don't know what is the underlying reason yet, but yes, definitely it's much more common in boys. And it is also said if you have a one child with autism, then the next child in the family, if it is a boy, it's a 15% chances our next child will have. If it's a girl, then it's a 5% chances. So even it increase the risk of boys having more chances of autism in the next generations too.
Yeah. Then, as a parent, Raj, like if you consider me as a parent, what should the parents do now, and what are the three things that you would like to tell them?
Look, I would say first thing is if you think that your child, whatever the red flags I mentioned, your child is deviating away from the normal developmental milestones which a child should be getting for that age.
Yeah.
Even though child may not be having autism, not necessarily that every developmental delay will be autism. You should see pediatrician to get the assessment done and get the ball rolling because the assessment process can take months. Later you start and more difficult it is going to be, and it's going to take a longer time because every therapist also there's a long waiting. The pediatrician there is a long waiting. Speech therapy, psychologists, occupational therapists, behavioral therapists, there's a long waiting time everywhere. So start the process early than the late. Second thing I would say, going into the stage of denial, which is a very common thing in our community, and in fact, over that time, has gone lesser when I started seeing these children 10 years ago, but denial stage is still there. We need to get over the religious and spiritual factor associated with this, with particularly in our culture, Indian
Yeah.
subcontinent point of view, and get over the guilt of bad parenting. It's not caused by bad parenting. And diagnosis also, you need to understand it is not the end of the world. It is a delay in a social skill, and majority of the time, this social skill and the play skill can be taught to these children to the stage where they can live their life independently.
Yeah.
But that is not possible by without that is not possible without your positive attitude, not possible without your commitment. It's a long journey. At the other end, don't over exhaust yourself. It's not a matter of 7 days of antibiotics and cough will be over. It is a journey of 2 years, maybe 5 years, maybe 7 years, maybe 10 years, in some cases maybe lifelong. So it's a long journey where your child will need your support on an ongoing basis. And many children in my practice, I see eventually they are able to live their life independently. They are able to go to the normal school, maybe able to need some help, little bit extra help, or some are going to special school, and then maybe some we bring back to the normal school, and then some continue in a special school for a long time and to develop their skill to take to the independent level.
Raj, just one last question before I try to wrap this conversation. So, as a parent, what advice would you give them to take care of their mental sanity? Because it's if you're telling that they've just got to terms with the fact that their child has this and maybe it's a lifelong process, in the end of the day they're also humans, they're also parents, right? Parenting is also new for them. So what advice would you tell them to take care of their mental strength and mental health in that case?
Look, That's why the first question I said, don't over exhaust yourself. Some of the parents, they come to me and say, oh, I'll sell my house, I'll sell my this thing, I want my child to be all right, and I want to put an intensive work, like as if the things will fix up it within days. No, it's not going to happen. It's a not a 100-meter race, it's a marathon, which is going to be in a long journey. And that is only possible if you look after yourself well. Your mental and physical health is important. If you are in a good mental shape, physical shape, you can look after your child. First thing is also, that's why I would say always look after yourself well. Look after yourself well means you should sleep well. And if you are not able to sleep because of your mental stress or physical stress, or your child is waking you up, because children with autism generally they have a sleeping difficulty, then you should get your help from your GP, or you talk to your pediatrician. You're seeing what could be the right pathway for me to go.
Right.
All right. Sometimes I do see there can be a family disharmony because of the child issue. Autism is a diagnosis. It is the diagnosis of a one child, problem of a one child, but eventually it impacts every member of the family.
Yeah.
If you have another sibling, and a child's another sibling, another child, make sure you are also giving some attentions to other child. He's not getting ignored. So you need to, because otherwise the point of sibling rivalry, the jealousy, will come. Why you are not giving time to me? Why every time is for the child? And then it means I should also be born as autistic, so you will pay attention to me. So I
Yeah.
do see these aspect of things too. So that jealousy is not good. Second thing, if there is a age gap between two children, like I've seen a child who has autism is 3 year old, and another child is around 12 year or 15 year old. Don't overburden your child to make her like a little mother.
Yeah.
Your another child is not a little mother for your child. It is primarily your responsibility to look after the child. Another older child can be a supplementary help for you. Use as a help, not putting too much of over the age responsibility on that child to look after, because that child will give up again sometime. These are the a few tips I would like to do. Always sit with your partner, with your husband or with your wife, and make a decision as a family. Not make independent decision that okay, I want for my child best and I will do this, because this is likely to cause disharmony. And
Yeah.
sometimes I've seen divorce happening between parents because of the child, and the third child, second child is getting affected, and the whole family is disrupted. So when we are all together as a family, when we are looking after each other's physical and mental health, are caring for other, anybody's keeping a sort of a balance that no one is getting ignored, I'm pretty sure that child will respond back very well.
For sure. For sure, Raj. Thank you so much. This was a very, very relevant and a very, very inspirational conversation. And to all our listeners and viewers on Chai Chatting community, if you've heard us for the first time, I really hope that you've had a lot to take away from Dr. Raj's experience and expertise on autism. As he rightly mentioned, there's nothing to feel ashamed of. There's nothing to feel guilty about. Please talk to your GP. Please talk to your child's doctor about this and get it normalized. There's nothing to feel stigmatized about it. We'll be back again with another important conversation that affects all of us South Asians and much more than that. But till then, please take care and stay safe. And Dr. Raj, have a very good night. Thank you.
Thank you very much.